is joint mobilization? Joint mobilization is a manual therapy technique performed by a physiotherapist using passive movements on the joint. These movements include gliding and traction techniques that are applied at different speeds and amplitudes. So the main goal of joint mobilization is to reduce pain, improve joint mobility, and restore normal joint function. So the main purpose of joint mobilizations are to treat stiff joints, reduce joint hypermobility, and reduce joint pain. Joint mobilization helps restore normal accessory movements within the joint, allowing patients to perform functional activities more comfortably and effectively. So joint mobilization is indicated for patients experiencing joint pain, muscle guarding or spasm, and reversible joint hypermobility. It is also useful for patients with progressive limitation of movement and functional immobility that affects their daily activities. So joint mobilization should not be performed in patients with hypermobility, joint effusion, inflammatory arthritis, malignancy, tuberculosis, osteoporosis, or ligament rupture. It is also contraindicated in cases of bone fractures, neurological involvement, and vascular disorders because mobilization may worsen the patient's condition. So before performing joint mobilization, the therapist should explain the procedure and obtain the patient's consent. The patient should be positioned comfortably and encouraged to relax. The joint is usually placed in the resting or loose back position because the joint capsule is most relaxed in this position. Next, the therapist performs an assessment including pain level, joint play and feel, range of motion, and the presence of any subluxation or dislocation. The therapist must also screen for contraindications and use proper body mechanics during treatment. The proximal segment should be stabilized and the mobilization force should be applied as close as possible to the joint surface. So let's move to the practical video.
Let's begin with traction at the radiocarpal joint with one hand fixed at the forearm and with the other group grasp proximal row of carpal bones. For anterior and posterior glide, the fixation still same as the traction. For the anterior glide, pull the proximal row of the carpal bones upwards, and for the posterior glide, push it downward. So for the next one, we will perform joint mop at the radioulnar joint to improve forearm rotation, specifically pronation and supination. For the radial deviation, we're gonna push it medially. And for the ulnar deviation, we're gonna push it laterally. So for the next one, I will demonstrate joint mop at the glenohumeral joint. Involved movement is abduction of the shoulder. For the glenohumeral joint, I will do inferior glide of shoulder or known as caudal glide. So firstly, I will do joint play for the glenohumeral joint to avoid dislocate. I will do it medially, laterally, superior and inferior. So firstly, I apply lateral traction to separate the humeral head from the glenoid fossa. Then I will glide the joint inferiorly.
First of all, the patient position is in supine lying. Therapist will support patient's hand and therapist will palpate the head of humerus. Long axis distraction is applied to the glenohumeral joint to create separation between the humeral head and the glenoid fossa, allowing improved joint play and reducing joint compression during movement. Next one, therapists perform joint play to the patient, which is inferior glide, superior glide, anterior glide, and superior glide. Next one, in grade 2 mobilization, posterior glide is applied to the humeral head using the hypothenar eminence, using oscillations technique for 3 times. So this is the full video of the joint mobilization of glenohumeral joint. First of all, the patient position is in sitting and elbow flats for 90 degrees. The therapist will palpate the proximal radial ulnar joint. This traction will be applied to the radius at the proximal radial ulnar joint to reduce joint compression and improve mobility. Next is perform joint play, which is anterior glide and posterior glide. Two oscillatory mobilization was applied to the proximal radial ulnar joint with anterior-posterior glides of the radius in 3 repetitions. So this is the full video of the joint mobilization of the proximal radial ulnar joint. So the patient position is in sitting and the elbow flats for 90 degrees. Therapist will palpate the ulnar head and the distal radius before performing the joint mobilization. Therapist will apply the joint play, which is posterior glide and anterior glide. And grade 2 oscillatory mobilization was applied to the distal radial ulnar joint with posterior glides of the distal radius for 3 oscillations. Next, therapist also performed 3 oscillations of the anterior glide of the distal radius. So this is the full video of the joint mobilization of the distal radial ulnar joint.
Knee joint mobilization can be performed using several techniques. These include an anterior and posterior tibial glides to improve knee extension and flexion, superior and inferior patellar glides to enhance patellar movements, and medial and lateral patellar glides to improve patellar tracking. Gentle flexion and extension mobilizations may also be applied to increase the knee's range of motions and to reduce stiffness. These techniques help restore normal joint movement, decrease pain, and improve functional mobility. Clavicle joint mobilization is a manual therapy technique used to improve movement and reduce stiffness in the sternoclavicular and acromioclavicular joints. The patient is positioned comfortably, usually lying on their back, while the therapist stabilizes the surrounding structures such as the sternum, scapula, or acromion. Gentle oscillatory glides are then applied to the clavicle in anterior, posterior, superior, or inferior directions, depending on the movement restriction. This mobilization helps restore normal clavicular motion, improve shoulder function, decreases pain, and increase the range of motion of the shoulder girdle. The technique should be performed carefully and within the patient's pain tolerance to ensure safety and effectiveness.